Okay, so we're going to be going over the Falls Risk Assessment Tool, or FRAT. Although these documents may look a little different from facility to facility, it is a national standard that every facility must incorporate certain content within their Falls Risk Assessment tools. Therefore, generally the content is the same, even though it may appear in a different format. These Falls Risk Assessment tools are generally completed upon patient admission to a healthcare facility. If the patient's condition deteriorates or improves, it's completed again. And if a patient experiences a fall, then this tool needs to be completed as well. Other than that, different facilities may have different policies as to the frequency that the tool must be reassessed, such as perhaps once a week or once a day. The Falls Risk Assessment tool is used to determine the risk of a patient's having a fall in the facility, with the idea that we can implement interventions to reduce this risk. So you always begin by adding a patient label or filling in the patient details. And then it's pretty straightforward as to the categories and how you fill them out. So the risk factor here is recent falls. It's asking, has the patient had a fall one or more in the last 3 months while as an inpatient or resident? If they have, then you would circle number 8. If they've had one or more falls in the last 3 months, so this would mean at home, you would circle a 6. If they've had one or more falls between 3 months and 12 months ago, you would circle a 4. And if they haven't had any falls in the last 12 months, you would circle a 2. Okay. Moving on, we've got medications. Medications that might increase a person's risk for falls would include sedatives, antidepressants, which can make people feel tired, anti-Parkinson meds, in particular if they're given late, diuretics, which makes people feel the urgency to wee and need to rush to the toilet, antihypertensive, so your blood pressure medications, and hypnotics. If your patient is taking more than 2 of these, you would circle a 4. If they are taking 2, circle a 3. If they're only taking 1 of these medications, or if they're not taking any of these medications. Psychological risks. If a patient has anxiety, depression, decreased cooperation, or decreased insight in regards to safety, or decreased judgment, particularly regards to mobility, that can also increase their falls risk. So if they appear severely affected by one or more of these conditions, you would circle a 4. Appears moderately affected by one or more, appears mildly affected, or does not appear to have any of these. So in this case, it's been circled that the patient does not appear to have any of these conditions. In terms of cognitive status, if you're not sure what the Hodgkinson's abbreviated mental test score is, that's okay, not all facilities use that. However, there is another option in terms of cognitive status where you can discuss, is the person cognitively intact? Are they mildly impaired, moderately impaired, or severely impaired? And of course you would circle the corresponding number. So in this case, the patient has had 1 or more falls between 3 and 12 months ago. He is taking 1 medication that could increase his risk for falls. He does not appear to have any psychological issues that would increase his risk for falls, and he seems to be cognitively intact, meaning he's oriented to person, place, month, and year, and understands what is going on around him. So his risk score is 8 out of a total score of 20, which if you look here, would put him at a low risk for falls. It's important to note that if a patient has a recent change in functional status or medications that affect safe mobility, or if they experience dizziness or postural hypotension, so basically if either of those boxes are ticked, it means they automatically become a high-risk status regardless of what their score was. So here I've just circled that they are a low falls risk. If they are a high risk, we're supposed to commence falls alert. Now that's going to vary depending on facility. Sometimes it entails putting a special wristband on a patient that's a certain color to notify staff that they are a falls risk. Sometimes certain precautions are put in place, additional standard precautions are put in place as well for high risk falls patients. But you'd have to look at your facility policy to determine that. So moving on, now we get into some more risk factors. So vision. If the patient has difficulty seeing objects, signs, or finding their way around, do they yes or no? In this case, no. Mobility. Is their mobility status unknown? So if they're a new admission, or do they appear to be unsafe or impulsive when they're up and mobilizing, or do they sometimes forget their aid? So in this case, the nurse has ticked off yes and circled that the patient tends to forget their aid. In regards to transfers, it seems that this patient is impulsive. So again, she circled what the condition is or the situation, and she's indicated yes, there is a risk here. In terms of behavior, does the patient appear to be agitated, confused, or disoriented, or non-compliant? Do they take risk-taking behaviors, or has that been reported from other facilities after a patient transfer? Have you observed that they are unsafe using equipment, or are they ambulating using unsafe footwear or inappropriate clothing? As a very simple common example, wearing socks on a hard floor is extremely slippery. In that case, the patient must have shoes, hopefully that the family can supply as soon as possible. Environment, do they have difficulties with orientation to the environment, not sure where the bathroom is? Are they underweight or have a low appetite, which could lead to increased weakness or fatigue? And do they have reported or known urgency nocturia, which means weeing at nighttime, or accidents? All of these can increase the risk of falls, particularly if the patient is trying to rush off to the toilet. So that's the first page. Moving on to the second page. Now we're going to go into detail about the history of falls. Prior to this admission, did the patient have any falls and or during their current stay? So the box has been ticked off and it's been circled that it happened at home. So the last fall was 4 months ago. The patient states his legs gave way and it happened at home. Moving on to the action plan. So the action plan is based on that first page where we completed part 1 and part 2. So for every section in part 1 and part 2, so looking back to the first page here, anything here that was positive for increasing the falls risk, and moving down here, anything that was positive in here for increasing the falls risk, we are now going to address in this next section. So, has the patient had a recent fall? Yes. The nursing intervention that we will do is determine the safe distance to mobilize the patient before they become fatigued, because he says that his legs gave way. In regards to mobility, the nurse has sent off a referral to the physiotherapist. With the transfers, now we did indicate that the patient can be impulsive and forgetful with using their four-wheel frame. So in this case, education will be provided or has been provided regarding using the call bell to seek nursing assistance and ensuring that the four-wheel frame is in reach at all times. And now the patient it was indicated that the patient had one type of medication that may have increased the falls risk. So a pharmacy referral has been faxed so that pharmacy can review his medications. What happens in this case is pharmacy will look at the meds and determine, does the patient absolutely require to be on this medication, or can an alternative medication be given that will reduce the risk of falls? Moving on to the bottom of this page, you just state the date of assessment, when this assessment needs to be reviewed, and then who completed the assessment. After that, this part is completed every time that the assessment is reviewed, and if it's indicated if any changes need to be made. So that is it for the falls risk.